Hi, my name is Dr. Lindsay Bonebrake, and I wanted to check in and kind of give you a brief overview of what play therapy is and why I use it in my practice. Um, it's really effective with children, and many elementary school age children don't have the cognitive ability to come home from school and say, "Hey, mom, I had a really hard day. My teacher said tons of stuff I didn't understand, and I didn't have the bravery to ask a question. I struggled with my frustration with my friend in the lunchroom, and on the playground, nobody would play with me. Can we talk about this?" Um, the level of cognitive functioning for elementary school kids just isn't quite there. And so it's up to us as adults, as helpers, as parents, as caregivers, to find a way to communicate effectively with our kiddos. And play therapy is one way that I have found to be very effective. So to me personally, play therapy is the opportunity for children to be heard. Some people don't take play therapy seriously. Some people think play therapy as if it was a relief from serious learning. But for children, play is serious learning. In fact, play is the method by which kids learn how to successfully navigate a lot of emotions and a lot of social situations. Play is the language and the work of childhood, and play therapy looks a little bit different than other kinds of therapy. The Association for Play Therapy says that play therapy is working with a child in a way that respects their particular development. And it helps develop their language. Play therapy can be directive, which is where the therapist directs the client in different activities or play, or non-directive, the client directs the session. Some play therapists adhere strictly to one of those two modalities. I have found it best to be eclectic and use what works with my particular client in that particular season of therapy. So the questions that I ask myself when I'm choosing what to do with a client are, does the client need to be in control? Have they come from a situation where everything was chaotic? Does the client need to learn how to follow directions and work in groups or listen to grown-ups? What style of play therapy is going to work with my client's history? Do they have a trauma history or otherwise? And what are their presenting issues? Why are they here in my office? I consider all of these things when I begin working with a client as well as throughout our therapeutic relationship, and I adjust as my client and their caregiver reveal what their needs are. Play therapy, just like any other kind of therapy, is most effective when a client feels safe to express themselves freely and heard. Common play therapy interventions that I personally use in my practice are sand tray, bibliotherapy, which is using books and literature, non-directive play, role play, art, games, social stories. I use these all regularly to facilitate the therapeutic relationship with my clients. I work hard to provide a safe space to listen. I participate and I observe children in an uninterrupted session of play that they may not have at any other time in their week. And it allows them to play out their stressors, their traumas, their feelings, and things they might not be able to verbalize, whether that's because they don't have the words, they don't understand what happened to them, or the words are too hard or too painful to say. Children work on a different timeline than adults, and sometimes that timeline is not linear, so the length of therapy can vary from client to client. And then lastly, the APT reminds us, the Association for Play Therapy reminds us that the most commonly, most common issues that our play therapy is used to work with are vast. So play therapy is used to support kids with all kinds of concerns: trauma, anger, adjustment, coping, loss, divorce, and then it also works well with children who have behavioral disorders, including conduct disorders, ADHD, depression, autism, anxiety, and or physical and learning disabilities. Thanks so much.